My mom, like so many people, was overprescribed opioids. It was in the early 80s where doctors were incentivized. They were paid more money if they overprescribed opioids. I was 6 years old at the time, and she became wildly addicted. I was so young that those challenges and that understanding came later. My mom's story is really falls in line with all of the policy failures at the federal level every step of the way, from overprescribing, lack of access to medication assisted treatment, lack of access to treatment in general. My mom says that when you're struggling with addiction, that the thing that you fear the most is withdrawal, not death. She started when she was constantly being cut off of her prescription without access to treatment. She started using heroin from a neighbor who said, "You'll never have to go through withdrawal again." She started overdosing at a high rate. And that's where I really saw the failures in the system when my mom was begging for help with nowhere to go. I realized then that Medicaid didn't cover substance use disorder treatment. And when you think about that, this is a medical condition that should absolutely be covered by Medicaid. You have a disproportionate impact on people who struggle with a substance use disorder who qualify for Medicaid if you actually address those challenges there, because this disease is highly likely to impact your income. So we changed the system. I directed the state to apply for a waiver that drew down hundreds of millions of dollars. It changed the face of our behavioral health system in Colorado. The first year alone, 52,000 people were able to get treatment. And when I first started in my work, 1 out of 10 people who wanted treatment could get help. And now it's 8 out of 10, which when you think about how far we've come, I mean, we still have a very far way to go. The story with my mom, when I was able to advocate for her as a state representative, she finally got the help that she desperately needed. And after 30 years of struggling, finally got my mom the help, the support that she needed. And she is about to celebrate 8 years in recovery. So she's an example of what's possible when we actually give people the care that they need.